Now to Africa, where confirmed Ebola cases continue to rise in the Democratic Republic of Congo. There's also some good news. The World Health Organization confirmed today 5 infected patients have recovered. Now, mortality rates are closely watched because this particular strain of Ebola does not have an approved vaccine, at least not yet. I want to bring in CBS News medical correspondent Dr. Céline Gounder. Quick reminder, she's an infectious disease specialist who spent time in Guinea as an Ebola worker during the West African epidemic. Dr. Gounder, always a pleasure to have you with us. Let's start with the good news. How encouraging or relevant is it about these 5 cases that seem to work in the right direction?
Well, look, if you have a case fatality rate of, let's say, 25, 30%, that means the other 75% or so are going to survive. So you're going to have some survivors from this, even with just supportive care. We do know the patient in Berlin, the American who was evacuated to Berlin, received monoclonal antibodies, and that his PCR, so that's a measure of the viral load, the amount of virus in the blood, dropped dramatically after receiving that experimental monoclonal antibody. You may remember monoclonal antibodies from COVID. The problem with those is require IV infusion. They are difficult to produce at mass, at scale, and they're very expensive. So even if this particular experimental monoclonal works, we still have more testing to do and then need to be able to scale up capacity and do so at an affordable cost.
Dr. Gounder, we talked last week about this quarantine facility in Kenya that is to be stood up by the United States government. It was blocked by a Kenyan court late last week. There were protests, as I understand it. What's the status?
Yeah, so hundreds of young Kenyans marched to the gates of Laikipia Air Base. This is the air base where they were building the quarantine facility. So you had Kenyan soldiers patrolling in tanks. Anti-riot police were being deployed. The local governor of the area said the facility will expose his people to Ebola. And he has a point. Many of the local people work on that airbase. And then Thursday, as you mentioned, the Kenyan High Court blocked the facility, calling it a threat to Kenyan life. By Saturday, American health officers had already landed at the base anyway. And then Kenya's health minister claimed the facility is for everyone, not just Americans. So you have a facility that the court said can't operate. You have American staff on the ground, and you have Kenyan protesters at the gates.
Is this why in the past, Dr. Gounder, these things were not stood up and Americans were simply flown to America?
Well, you have whether it's an American health aid worker or an American soldier, don't you want them to get the best possible medical care if they are injured, if they develop an illness in the course of service? And the best way to do that is as early in their course of illness, whatever the cause, as possible before they deteriorate. And so to send them to a Kenyan facility that is being stood up ad hoc at the last second without all of the normal infection control capacities, the normal kinds of equipment that you would want, for example, being able to put somebody on a ventilator, being able to give them dialysis, being able to give them heart-lung bypass. That's not going to be the kind of care they're going to provide there. And so you're basically dooming them to this middle tier of care in a field hospital when they should be flown to the very best that we have built here in the U.S. over more than a decade with billions of dollars. We have built the capacity to treat patients just like this.
Dr. Céline Gounder, appreciate it as always. Thank you.